at you, but we do have the Healthy Kids AZ app that is provided by the Arizona Department of Health Services. And again, what this looks like is that it allows you to navigate, if a student's experiencing any sort of symptoms, illness, animal bites, things like that. It kind of like tells you what to do, where to go. Also offers resources, including like emergency management or even bullying resources if like one of your students may be experiencing that. So those are just the couple announcements. And again, like I said, May 7th will be our last school health update call for the year or the school year until we go on to summer break. So that's just all the announcements we have there. I'm going to pass it over to Epi. Jake, are you on the call? Oh, I know you're on the call.
Yes. Good afternoon, everybody. My name is Jake, and I will be presenting our respiratory and measles update for EPI. So currently, we are in week 12 of the 2024 to 2025 respiratory season. In the current respiratory season, we have had 1,268 confirmed RSV cases, which is 48% more than usual. As you can see from this figure, we are starting to enter the end of respiratory season, which also correlates with a decrease in a lot of these respiratory viruses, which is really, really good to see. Next slide, please. This figure shows our flu counts by MMWR week. In the current season, we had a total of 6,464 confirmed cases, which is 166% more than usual. This was a very active flu season compared to the last few years that we've had. In our previous week, we did have 108 cases, but similar to RSV, we are seeing a pretty significant drop-off as we move out of respiratory season and into the summer months. And next slide, please. Here we have our COVID counts. In the current season, we have had 7,552 confirmed cases, which is 84% less than normal. Last week, there were 105 cases, which is 30% fewer than the prior week. And similar to the other respiratory viruses, we're starting to see that normal seasonal drop-off as we leave respiratory season. Next slide. And finally, this figure just shows the three respiratory viruses plotted on top of each other. And as you can see very clearly, there's been a very significant drop-off as we move out of the winter and towards the summer months. Next slide. All right. I believe that these slides were actually presented at the last school update call, but given everything that's been going on with measles, we thought it would be appropriate and helpful to have them shown again. So the next, I think, 15 slides or so are about measles and what school staff needs to know. So the signs and symptoms for measles include a high fever, the 3 C's, which are cough, coryza, and conjunctivitis. Coryza is inflammation of mucous membranes. So a lot of symptoms that are associated with that are things like postnasal drip, runny nose, stuff like that. There's also something called the Koplik spots, which are small white spots that appear inside an individual's mouth. This also is paired with a red blotchy rash, which usually appears 3 to 5 days after the first symptoms develop. Some complications of measles include pneumonia, encephalitis, and death, which can happen in malnourished children. It's a very dangerous disease, and so that's why it's important to be able to recognize it very early. Next slide, please. So these are some photos from the CDC of measles and individuals with measles. So on the left top, you can see the Koplik spots on the palate. So something that's, pretty obvious that shows up, and something that you should definitely keep an eye out for. Hopefully it doesn't get to that point. But if you have someone who's consistent with these symptoms, that would be something that you would want to check. Next slide, please. So some basic measles transmission. It is airborne, so the primary way that one individual would transmit it to another person would be via respiratory droplets from coughing or sneezing or talking, anything that generates aerosolized, sputum or saliva. It is an incredibly contagious virus. One individual can infect anywhere from 9 to 18 non-immune people. That's very, very infectious. Uh, Additionally, the virus can remain uh, airborne for up to 2 hours, and so airspaces and congregate areas that have had transmissive individuals can remain dangerous even after that individual has left an area. So it's important that if there was an individual who was positive, that the room is cleared out, cleaned, and then nobody goes into there for a while. Uh, Individuals who are at risk are unvaccinated individuals. 9 out of 10 unvaccinated individuals will contract the disease if they're exposed. So vaccination is incredibly effective, and it is very much so recommended that everyone get their measles vaccine if possible. Next slide, please. So this figure is just showing case counts for the United States and then neighboring countries, Mexico and Canada, for their most recent counts at least. So as of April 1st, which was yesterday, Texas had 422 confirmed cases and New Mexico had 48. In Canada, as of March 28th, so that was Friday? Friday or Saturday? No. Yeah, it was last Friday. There were 496 confirmed cases, and the counts are year to date for Epi week 11, so that's up until March 15th. So they're still having data coming in for that. And then as of March 20th, Mexico has 50 confirmed cases. Next slide, please. Oh, sorry, can you go back to the previous slide real quick? Sorry about that. If you do want up-to-date case count information, the CDC link that's at the bottom of the page will provide updates regularly. So I would recommend that you check that if you want up-to-date counts information. Now, next slide. So for measles vaccination, 95% or greater immunity is needed for community protection. Worldwide, only 83% of individuals have received a single dose. In the United States, 92.7% of kindergartners have received 2 doses. And in Arizona, only 88% of kindergartners have received 2 doses. And that's what we would want to see the 2 doses is what we would want to see full coverage, but we're not entirely at that 95% threshold across the state or across the country. Next slide, please. This figure shows Pima County measles vaccination rates by grade and by year. So as you can see, in kindergarten, especially from 2015 until 2023, there's been a pretty significant decrease in vaccination rate. There was an increase from 2022 to 23. However, it's still below that 95% threshold, which is what we do really want to see. And while 6th grade and childcare age are above that threshold, as you can see, there has been a slight decrease over time in the vaccine rate for individuals in those grades. So making sure students and especially their parents know how important it is incredibly important. Next slide, please. Similarly, this shows the MMR vaccine, so that's measles, mumps, and rubella, vaccine rate by year and school type. As you can see, there's been a pretty significant drop-off in charter schools and private schools, while public schools and childcare centers seem to maintain just above the 95% threshold for the MMR vaccine. Next slide, please. So vaccine recommendations for this include 2 doses of the MMR vaccine, The first dose is given at 12 to 15 months of age, and then the second is given somewhere between 4 and 6 years of age. Adults who are born before 1957 are generally considered immune, and healthcare workers should verify immunity or receive 2 doses. Any adults who were born between 1968 and 1989 most likely received at least 1 dose of measles vaccine or MMR and are thus immune. Adults who were born after 1990 likely received 2 doses of MMR if they completed the routine pediatric vaccine schedule. So that's the 12 to 15 month and 4 to 6 years of age. Pregnant individuals should not receive the MMR vaccine, and you should consult with a doctor before recommending the MMR or MMRV to immunosuppressed individuals. However, during an outbreak, vaccine recommendations may change, and I would be sure to tune into recommendations from either Pima County or the CDC to find out what those may be. Next slide, please. So there's a couple different ways you can get vaccinated for measles. They're widely available at commercial pharmacies, pediatrician offices, and at Pima Health Department clinics. If you do have students who are uninsured or underinsured, they can receive immunizations at a Pima Health Department clinic. And then for any sort of clinic information or questions that you have, including available immunizations, this can be things other than MMR as well, please visit pima.gov/vaccines. And next slide, please. So here's a number of measles vaccine prevention strategies. You can have one-on-one conversations with hesitant parents, review vaccination records for compliance, engage with the PTO or PTA for advocacy, offer incentives, and send reminders out for student compliance. Again, getting that vaccination threshold over that 95% is really important. So putting out as much information as you can and communicating with families is going to be some of the best ways that you can take to actually improve the vaccination rates. Next slide, please. And then as far as transmission prevention goes, as always, encourage hand washing and sanitizing, and perhaps even more importantly, encourage students and staff to stay home when sick. If a student or staff member is not at school, they can't get someone else sick. So make sure if someone's not feeling well, they go home. Isolation is always going to be the most effective practice. Next slide, please. It's also important for schools to develop a preparation strategy and a measles action plan for the school. So this could include things like how your school can increase immunization rates, rapid communication and notification plans in the event that a student does get sick. Again, in the event that a student or staff member gets sick, have isolation protocols, rapid identification of vulnerable students. This could be underinsured, undervaccinated, any sort of at-risk population, and then having standardized cleaning and disinfection protocols. As far as communication goes, it can be really helpful to have pre-written templates, so emails, social media posts, etc., for quick messaging in case of an outbreak. You know, if there was a potential case, you don't want to have to come up with a letter to write home to the parents. It's better to just have that already done. Then you can communicate with them much more quickly and much more effectively. Next slide, please. Finally, what should you do if you do have a suspected case? So first thing, isolate and mask the patient immediately and call the Pima County Epidemiology Department at 520-724-7797. You also want to collect all the patient information, including things like demographics, symptoms, their medical history, and immunization history. Providers or physicians would probably be the ones performing specimen collection. The preferred ones are urine or NP swabs. At a school, you would definitely want to document potential exposures, including anyone present at the same time and their vaccination status. Again, individuals who are not vaccinated are going to be highly at risk, so it's important to determine if exposures would fall into that category. Next, you would want to have parents take the child for a medical evaluation, and importantly, have them call the facility before arrival. Remember, airspaces that have been exposed to individuals with measles are contagious for up to 2 hours, so giving them time to prepare and set up an isolated area for the suspected patient is very important. And then the provider would collect additional specimens as needed, detail their symptoms, and any other lab tests. And then finally, we would want to clean and disinfect the room and close for 2 hours to allow for proper air circulation. Next slide, please. I think that's the end of the measles bit, though.
Yes, there is. We got a question in the chat. Linda asked, do you have any templates? I'm assuming templates or template letters for parents. I'm assuming that's what the question's about.
I can certainly check. I don't know where we are in terms of measles for template letters, but I can definitely check. And if we do, I will. I can send that out to you, or I could actually send it out to you, Chris. And then if you want to distribute it as requested or as you feel is appropriate.
Of course. Thank you, Jake.
Thank you very much.
So we're going to go ahead and move on. Caitlin, are you on the call?
All right, good afternoon, everyone. So I am here to talk very quickly about rabies, as well as how the Pima County Health Department can provide resources, education, and outreach to your staff and students for rabies prevention. Next slide, please. So a quick overview of rabies. Some of you might be familiar with this, and some of you might have seen these before. But rabies is a serious and fatal disease. It's spread through the saliva of an infected animal, usually through a bite or a scratch, but it's spread through the saliva. It travels through the body into your spinal cord and brain to cause inflammation and ultimately is fatal. So quite a serious disease. Rabies, interestingly, is not airborne, and it's not spread through contact with blood. It's only spread through saliva or the brain matter. So once symptoms of rabies appear in a person or an animal, it is 100% fatal. There's no treatment for rabies, which is why we emphasize rabies prevention and post-exposure prophylaxis, or the rabies vaccine. Next slide, please. So typically only mammals carry rabies. You're not going to find reptiles or birds able to transmit rabies to other people or animals. In Arizona, our most common hosts are bats, skunks, and foxes. We're particularly concerned with bats when it comes to especially school campuses. We have many different species of bats here in Arizona. Some of them do migrate or hibernate for the winter, but many of them are active all year round. And the bat species that we have here are also fairly small. So it's not uncommon for bats to become stuck in classrooms, offices, or anywhere else on school campuses. Additionally, sometimes adults or children will pick up a bat, not really recognizing what it is. So while we've all probably seen bats flying around in the air, often people are not used to seeing them on the ground. So we commonly hear about people who went to pick something up off the ground, thought it might have been maybe a leaf or a piece of trash, and it turned out to be a bat. So those are of particular concern just because of some of the behaviors, as well as people not really knowing if they might have encountered a bat. Additionally, we have a unique landscape here in Tucson. We do have a really unique landscape where wildlife mixes with our urban areas. So wildlife encounters might be more common. It's not entirely out of the ordinary to see a bobcat, coyote, even some animals like foxes or skunks around neighborhoods, having encounters with people, or on school campuses. Last year, there were not only a handful of bats that were removed from school campuses and sent for rabies testing. I believe we also had a raccoon as well. So it's not unheard of to see wildlife on school campuses. Next slide, please. Okay, so what can you do if you find a bat or other wild animal on campus? Pima County Health Department and Pima Animal Care Center typically work together when there has been a possible exposure or when there's concern for a rabies exposure event. So staff, administrators, nurses, they can call Pima Animal Care Center. They will come out and help you find the animal, locate it, remove it safely. It should be emphasized that staff shouldn't handle any wild animals and they shouldn't handle bats with bare hands. If a staff or a student has any contact with the animal, we want to hear about that so that we can talk you through the steps and provide any advice towards getting the rabies vaccine or any other post-exposure prophylaxis needed. So we have our contact number here, similar to when Jake shared with measles, 520-724-7797. That will put you in touch with one of our staff who can answer your questions and provide more information about rabies. Next slide. Another thing that we've started doing this year is actually going out to school campuses, providing resources and doing presentations to really teach the kids about rabies prevention. We do this because schools are really important partners for delivering this education and outreach. Schools have a wealth of knowledge, they're a hub of community, and school partners can be great in helping reduce these rabies exposures. So in 2024, as I mentioned, there was the raccoon that was removed from a school campus. There were also 13 bats. So it's not uncommon for us to hear about or get reports of students finding bats or having other encounters with wildlife. Additionally, another possible exposure occurs through dog bites on campus, near campus, kiddos walking to school, waiting for the bus, the occasional stray dog. So school outreach is really important for us to be able to reach the kiddos where they're at and also work with school staff who you guys are working with these kiddos every day. You know them very well. You know what their daily routine is like. And you're probably going to be one of the first people they come and tell if they do find a bat or if they do have an encounter with a dog while they're walking to school. Next slide, please. So we do offer resources. We're able to offer in-person or virtual presentations on rabies, going over what it is, how it kind of works in the body, as well as how to prevent it. It focuses a lot on just general safety around animals, as well as emphasizing telling an adult. And they are tailored to be grade level appropriate, so we can deliver them to kindergartners all the way up through high school. These presentations are available to any school in Pima County. So you'll see here San Fernando Elementary. We've traveled out to Sasabe. We will go anywhere in the county that folks are interested. And we're also willing to offer virtual presentations as well. We can offer presentations to a single class. We can do whole school assemblies. We are flexible to work with whatever your teachers or administrators are interested in. We do have a survey online. This link here in the slide is clickable, and you can fill out the survey. It takes about 2-3 minutes. You can request your preferred date, format, and any other questions you have about outreach materials there as well. So we've tried to make it very convenient for school staff to come to us and request this information. All right, next slide. All right, and that is it for me. Thank you so much.
Thank you so much. So next we have our tobacco prevention program. Angela, Jennifer, you on the call?
Yes, we're here.
Yes.
Hi, everyone.
Take it away.
Okay, so I'll go first. Hello, my name is Angela Montier. I'm with the Tobacco Prevention Program, Public Health Program Coordinator.
Okay, next slide, please.
With all of our, to let you all know that we probably seen us at your school if you're a Healthy School Initiative uh, school. With all of our presentations, we do a line acknowledgement, but not only that, we do a commercial tobacco is not traditional tobacco acknowledgement, acknowledging that the two local tribes, the Tohono and the Pasquayaqui tribe, have used tobacco and regarded as a sacred plant. And so with that, we have our campaign called Keep Tobacco Sacred, where we talk about the use of tobacco and within the two local tribes. So I always say this is a picture of a tobacco plant that you might see when you're hiking or in the Sonoran Desert here. And so also we teach children to respect it and to not touch it. Next slide. So why does this matter? So with our Keep Tobacco Sacred messaging, we have we know that that tobacco use is a leading preventable cause of disease, disability, and death in the United States. We strive to provide culturally appropriate presentations and keep tobacco sacred printed materials and the use of digital resource materials and materials. We know that American Indian Alaska Native population has the highest prevalency of cigarette smoking in 29 compared to any other population in the United States. 97 About 97% of American Indian Alaska Natives high school students reported ever using electronic nicotine devices, smoking products, compared to 50% of all high school students. That was according to the 2019 youth survey. And so we have so we're going to do a brief overview of how our youth through the Stand Youth Coalition through the state, the Tucson Indian Center Native Youth Coalition has a goal or a action plan of educating the community on the difference between commercial tobacco and traditional tobacco. So what you see here are posters, messagings, that the Native Youth Coalition has done some cartoons that where they're able to explain the difference and not go with the stereotypical, because a lot of the especially cigarettes, they'll have a stereotypical Native American either designs or names or headdresses or those types of things. So they wanted to acknowledge that, you know, that the myths and some of the harms that tobacco and vaping can cause to the body. So the Native Strong Vape Free, currently it's not available through the FDA, but we're hoping that it will come back. Next slide. With that, we have a Blackout Tobacco Day and other days where we acknowledge to the keeping tobacco sacred. We have paintings. There's Superintendent Williams in the middle, where he is also a very strong advocate on the Real Deal on vaping, and this is part of the Real Deal campaign. And there you see the Native Youth Coalition presenting metal signs at the gardens, where Mission Gardens, they're at on the base of a mountain. Next slide. So again, we know that cigarette smoking has decreased. However, among young people, electronic cigarettes has increased. Among that, we see here that the most popular is the Elf bars, followed by the Escobars, Voz, Jules, and then Mr. Fogg. So it says more than 1 in 4 use e-cigarettes daily. We know that that's probably more now. And now we have an added, we know now that there's a lot of young people in the schools using nicotine pouches. So we're in the process of developing a fact sheet for teachers and professionals to use to know the facts about nicotine pouches, commonly known as Zyn packs. Next slide. And so with that, we also know that co-use of cannabis and tobacco is more prevalent than the use of cannabis or tobacco alone for youth ages 12 to 17. Within Pima County schools, we know that we've more than likely they are confiscating vaping devices that are cannabis vapes, along with nicotine vapes, but more so they're seeing more of the cannabis vapes. And with that, we also do the Arizona tobacco retailer, where we have smoke shops who have failed inspections or have provided these products to my underage youth. They are to come to here to Abrams, and they take a training and then present those to the court. So we also have an Arizona tobacco retailer training that we offer here at Pima at Abrams. Next slide. And so the Pima County Schools Vape-Free School Initiative is to enhance, of course, the vape-free school, smoke-free schools in Pima County. We have toolkits that we offer to the schools. The Healthy School Initiative is one of them, where we offer a $2,000 stipend to teachers or anyone that the principal feels that can. We have school nurses, we have monitors who are appointed by principals to do the work of the Healthy School Initiative program, wellness coordinators. So we offer them certifications that they can do through the American Lung Associations. We also have Catch My Breath, which is a free, which we'll talk about in a later slide. We also provide a way for them to get training for in-depth or in-depth online, which is an alternative to suspension. So if they get caught with vapes, a vaping device or any tobacco products on campus, in lieu of being suspended for 2 weeks, that they do the in-depth program. And at the end of the program, they will receive a certificate of completion. And so currently we have about 7. We're recruiting more schools every week, it seems like, because it has become an issue, and it has been working for other schools, especially in the Marana Unified School District and in the Vail School District. So we also offer training with American Lung Association for the NOT program, which stands for Not on Tobacco. And that is a cessation program, because we know that youth are struggling with nicotine addiction. And so this is for those who would like more support in quitting. Next slide, please. And with that, this slide is just an overview of both. What's the difference between the Healthy School Initiative, the in-depth online program, and the Not For Me online program. Next slide. And so go ahead and click. I think it's clickable. So Healthy School Initiative was formerly the Coordinated School Health, and that more focused on nutrition and exercise. And so starting in 2021, it was brought over to the Tobacco and Chronic Disease Prevention Program, and we renamed it the Healthy School Initiative, where we recruit public school teachers to provide youth tobacco education within the school. We we set goals and strategies that they have to complete within the school year, and that all in the areas of tobacco prevention. We also provide training, technical assistance, and resources to the teachers, so they will be ready and competent to do the work within the schools. Also, we offer a $2,000 stipends to the wellness coordinators. Go ahead. Next slide, please. With that, I just wanted to overview the requirements. So in order to become a Healthy School Initiative wellness coordinator, you would need to complete and implement the strategies action plan with your principal. Principal does need to sign it. Coordinators will complete 3 trainings, which is our free online training modules. Each one is approximately an hour to complete. The first one is tobacco basics, asthma basics, and ACT. This ACT training is to address use cessation training. Next slide, please. The next requirement is to identify a minimum of 5 strategies, and then to attend a virtual tobacco prevention education training with us at Pima, with our staff. And just to, we have a online tracking reporting portal where they have 5 questions where you can just let us, actually that's a monthly report that you do every month at the end of the month through our portal. Next slide. These are some of our schools that we had in 2023-24 school year. This has doubled, actually almost doubled in 24-25 school year. Next slide, please. This is an example of one of the strategies. It's very easy to complete. So this one, all you would have to do is send us your school logo. This is an example of the Carrillo Cougars. Their school logo is there. So Pima County Health Department school logo, the school logo, and then the Pima County School Superintendent's logo is on these metal signs that your school will receive if you select this strategy. As you can see there, we do have smoking, vaping devices, smokeless tobacco, and cannabis on these metal signs. And so this is what you will receive if you become a Healthy School Initiative Wellness Coordinator. Next slide, please. And then next we have the Stand Youth Coalitions. We have 5 youth coalitions within Pima County. This is a picture of 2 of our Stand Youth Coalitions, or 3, Empire High School, the Native Youth Coalition, and the Anza Trail Stand Youth Coalition. Next slide, please. And so what they do is tobacco prevention coalitions. They use education and community engagement to expose the tobacco industry's predatory marketing strategies. Coalitions empower community members to advocate for policies and programs that reduce commercial tobacco use and protect communities' health. They were instrumental in the initiative for the age to be raised from 18 to 21 within Pima County, and they're doing a lot of great work within their schools in peer-to-peer education. Next slide, please. Next are some of these slides, what we provide as to Healthy School Initiative schools and vape-free school initiative schools is common myths. This is an example of a slide that we use just to illustrate, you know, how some of the myths are out there. Like it's safer, it's cleaner than cigarettes, it's a stress reliever, you can't get addicted, there's no real health risks. So we know that this is another toolkit that we use called the coming from Stanford Medicine Reach Labs. And this is a great visual because a lot of our, a lot of us are very visual. We have to see it in order to like, wow, that's a lot of nicotine there. So as you can see, 1 pack of cigarettes is equal to to 20 cigarettes here. And then 1 joule pod is equal to 37 cigarettes. A flume float is equal to 363 cigarettes. And 1 elf bar, which is like we saw in the earlier slide, was that it's the most popular among young people, is equivalent to 590 cigarettes. Next slide, please. And so we know that it is illegal for stores to sell to minors. You have to be 21 years old in order to buy any commercial tobacco products. The federal regulation 21 CFR 1140. It's a federal law, so so how are they getting it? So we talk to young people as to how they get it. Usually it's through online or just going to vape shops that are open 24/7. And so there's a lot of policy changes that that our youth coalitions are looking at and trying to see how they can uh, either stop vape shops from selling to minors or making some policy changes there. Next slide, please. This is another example of tobacco, an illustration of what we use in the schools. It takes 600 ingredients to make the cigarette. We have about 150 years of knowledge of what it can do to the body. We know that once you light this cigarettes, it emits 7,000 chemicals once lit. And so we talk about all of the, some of the things that you might find in the cigarette that people might not know. And also the like formaldehyde is found both in cigarettes and in vapes and other harmful chemicals that are in both commercial tobacco products. Next slide, please. And so vapes, even though it has less chemicals, which is 31 known chemicals, it still contains highly volatile organic compounds and ultra-fine particulates or particles that go into our alveoli sacs in our lungs, heavy metals, nickel, tin, and lead, and flavorings such as diacetyl and acrolein, which can cause irreversible lung damage. It can also cause other things that we will illustrate in the next couple slides. Go ahead, please. This is just an example video of what we use for Catch My Breath. Catch My Breath is absolutely free. It offers curriculum and videos, and also it has sample letters that you can give out to parents to say, oh, we're going to be talking about tobacco and vape prevention. And so they offer curriculum. They also offer these videos. This is just a little snippet of what you will get with Catch My Breath. And I'm trying to go kind of fast because there's so much information in regards to tobacco and vape prevention in our schools. Next slide, please. These are some of the products that you'll see. So we do teach when we do professional developments with teachers or with student leadership groups like student councils who do peer-to-peer education with the during lunch hour or after school programs. This showing how first generations look similar to a cigarettes, and then second generation, third generation, and then now there's more and more heavily aggressively advertising to our young people with these colorful skins and colorful flavors. Go ahead and next slide, please. With that, we always get calls at the beginning of the school year saying, have you informed our teachers about these concealables? We're finding more and more of these products that are disguised as other products. And so we see highlighters, Sharpies, markers, and other clever, they conceal. The hoodie right here is also a vape, the hoodie string here, and the backpack and the inhaler. Next slide, please. So these are from 2024. These are the most popular ones. This one looks like a little Lego lion. The juice box that looks like a juice box. The Candy King, the whipped vape e-liquid that you see there. Next slide. This is pretty new. This is these commercials come on when they're doing so these are video games that you can okay, let's pause that one. These are video games that are actually in the sides of the vape. So you have Pac-Man, you have Tetris, you have other popular games. Some of the flavors that they offer target young people like Yummy Gummy, Watermelon Breeze, sour watermelon sour berry, and the flavor of WTF. So WTF, you know, youth are very curious or like, I want to try WTF. Let's see what that tastes like. So these are these commercials are being advertised, these 30-second clips during when they're gaming, maybe on Roblox or other gaming, online gaming. So as you can see here, the cost there is $14.95, and it's as easy as just getting a hold of you know, a credit card or a gift card that they've received. And then that's a lot of young people have said that that's how they would get these products. Next slide, please. So what's in the vape? So this is another example of how we educate the community, our health educators, and our professionals, administration, and our youth of how it works. It does have a battery. It has a cartridge that holds the liquid, an atomizer that heats it up. Next slide, please. And what is aerosol? So we know that cigarettes smoke has smoke, and vapes have aerosols. So it's this it's like a hairspray can. This is an illustration that we give to the young people. It's like hairspray. It's a matter of it's a aerosol spray where it is pasteurized air. Next slide, please. And so we know that secondhand and third-hand smoke exposure can cause a source of anxiety for young people. So even if they're not smoking, but someone, an adult, is a caregiver is smoking around them, they can be exposed to the secondhand and third-hand smoke. Kids can't control their environment. We offer education resources and support to parents and guardians, and we'll be learning about One Step in the next couple of slides with Jen. And we know that secondhand smoke kills about 40,000 people a year. Go ahead. Thank you. Next slide. We'll just go to the next slide. We're kind of want to go faster on this one. And so now I'm going to turn it over to Jen. She's going to tell you all about One Step program. Thank you.
Hi, everyone. Thanks, Angela. So as Angela was explaining, we do have this training is called One Step. It's in partnership with the American Lung Association, and this is a training specifically for early childhood educators and organizations who work with 0 to 5 population. And this training is to provide some tools and information on how to have health-focused conversations with parents and guardians for secondhand smoke prevention. So it's a very valuable training and one that comes with resources as well that can be placed in resource areas, resource tables, bulletin boards, so that information is readily available, as well as resources for cessation through American Lung Association or ASHLine, which is the free statewide quit line. Next slide, please. And this is a clickable slide here. So this shows us, back one. Thanks, Chris. That we have just this example of second and third hand smoke. So we saw the person who was smoking, and the person has left, but now there's things left behind, and those are second and third hand smoke. So we may not have heard of third hand smoke before. Second hand smoke, of course, is the smoke or aerosol that is coming off of the end of the device or cigarette, or being exhaled by the person who's smoking or vaping, that we inhale, and anyone else around them. And so the risks of that are in the secondhand smoke. Third hand smoke is when that is gone, but yet the chemical residues and the smells are still there. So that's illustrated here in this slide with the little dots. And we see the baby on the carpet, the pets. It's on the furniture, and young children and pets especially are very susceptible to third hand smoke because they're on the ground, they're on the furniture, and pets as well are that are exposed have negative health effects as well. So this is something that we're learning more and more about too. This is also important for prevention for early childhood educators to share the information as well, because even third hand smoke, if a person is using the products and they carry the baby, or they're holding their child, or there's items that are going back and forth, backpacks and so on, those all can carry the residual chemicals, and so it's very important for prevention to provide that information to protect children from second and third hand smoke. Next slide, please. All right, so just a little bit more information, effects of secondhand smoke. We know 50% of all U.S. children ages 3 to 18 are exposed to secondhand smoke, and it causes serious health problems, including SIDS, which is sudden infant death syndrome. It increases chances for middle ear infections, respiratory symptoms, can trigger or cause asthma, causes impaired lung function, and can cause chronic lower respiratory illness. And so there is no safe level of exposure to secondhand smoke. And for some, even brief exposure can cause harm right away. Next slide, please. Just some examples that we might see. These are toys and vapes in the same slide. So these can easily be mistaken by a baby, toddler for a toy, when in fact it's a discarded vape, or a vape that might be left within reach of a child. Next slide, please. As a result of that, from 2013 to 2017, about 5,000 children under the age of 5 were treated in emergency rooms in the US for e-liquid nicotine exposure, and which is very dangerous. Those levels in a young child can cause severe symptoms, to include coma. So it's very important that we're aware of these symptoms of nicotine poisoning so that quick action can be taken if it is suspected. Next slide, please. So nicotine effects on our brain, we know it can worsen anxiety, amplify depression, produce higher levels of ADHD symptoms, can increase stress, and even 5 milligrams of nicotine is enough for an adolescent to become addicted. And our brains are not fully developed till we're about 25. So the youth brain, the teen brain, the young adult brain is much more susceptible to addiction because the brain is not fully developed at that time. The next slide, please. We have Ashline is our statewide quit line. It is completely free to anybody in the state of Arizona. Ashline has a program called, a specialized program for youth called My Life, My Quit. This is specifically for youth 13 to 17. It does require parental or guardian consent. However, this is a resource that is available that can be shared with youth, with families, for youth to utilize to help them to quit any tobacco product. So those products we saw earlier, the vapes, the nicotine pouches, and the different types of products, they're all considered tobacco products because they contain nicotine, and they all would fall under under Ashline. So so My Life, My Quit is available for those youth, and has features that make it much more friendly to use for the youth, like text and chat features that are specifically developed for youth. Next slide, please. A little more information about My Life, My Quit here. It can be contacted. There is a dedicated line, but also the general number for Ashline, the 1-800-556-6222, or more easily to remember, the 5566222 that you see here, or the text code. So it's very, very easy to enroll for the Ashline program. And next slide, please. Well, thank you. Angela and I can put our emails in the chat if that's okay. If you are interested in getting more information about any of the information that we shared today, we would be very happy to be in touch with you and connect. So thank you so much.
Thank you so much. I appreciate this wonderful presentation, Jennifer and Angela. Yeah, that concludes our school health update. If you have any questions about what was presented today or anything, unrelated to our presentations, you can always give us a call at 520-724-7018, or you can email us at schoolsupport@pima.gov. And Jennifer dropped her email in the chat as well if you're interested in any of the tobacco initiatives that Pima County Health Department is doing. But that being said, that is our presentation. And if there are no questions, you can hop off. And I hope you have a wonderful Wednesday, a great April, and we'll see you for our last school health update call in May.